Pain medications and surgery are not the only answers to knee and hip pain or back pain or your shoulders constantly bothering you. Incredible advances in medicine are helping your body heal those old injuries.
I know, as we get older, I have so many old injuries that are popping up, they don't go away.
Starting to show themselves.
Right, so you might want to look into regenerative medicine. It is the latest tool to repair damaged tissue, even injuries or pain that you've had for years. And here to tell us more is Dr. Joel Tredak of Denver Regenerative Medicine. We always love having you on because this is really cutting edge stuff. It's great for people who have these old injuries that are nagging, they don't go away. Tell us what regenerative medicine is all about.
Regenerative medicine is a new field in medicine that focuses on replenishing or repairing those things in your body that your body's either damaged or lost over time. What we focus on in our field of regenerative medicine is replacing or fixing damaged tissue, muscles, ligaments, tendons, things that happen as a result of acute injury, playing sports, or just from getting older in life. We can repair that tissue with regenerative medicine and make the tissue heal and become new like it once was before.
I like the so incredible, the latest advances. It's incredible. So if you would kind of walk everyone through kind of the experience a patient would have when they come to your office.
Well, what the patient does, they come to our office, they'll see a big, nice, spacious parking area. Lots of room, lots of space. We're located on Holly and Evans, just south of Evans on Holly.
Great location,
That is a great location. And, you know, we're seeing pictures of your office. In just a minute, we're going to see part of the consultation that you do with patients. People really need to come in and do that consultation so you know what the next step is, right?
Yeah, absolutely. So when people come in, they'll come into our waiting room. They'll be greeted by our staff. And then after we have them fill out all their paperwork and all their information about why it is that they're coming to visit us, we will take them to an exam room and conduct an ultrasound exam on them and make sure that what we're looking at is actually where their problem area is. So we can match up the ultrasound with the MRI, as you see here in this picture.
Right.
We can match up where the injury is with where you can see it on an MRI. Our medical staff will find where the problem is. Our doctors will explain to you what you're looking at. And there we can see somebody's shoulder being evaluated. It's a non-invasive procedure to use the ultrasound and look at the problem. There's no radiation, there's no harm to you, there's no after effects of having the examination done. And as you can see here, we can really see the fine muscles, we can see the tissue. We can see exactly where there's a tear, where there's a damage that has already been done.
Now once you kind of hone in on it with this ultrasound, what are the different therapies that you can use to treat the different conditions?
So we have two main therapies that we work with, platelet-rich plasma, or PRP, and stem cell therapy. Both of those involve taking a sample of blood from the patient, taking that blood, spinning it in a centrifuge so that we can isolate the blood into the different fractions, and then take just that layer of blood that contains either the platelets in the case of platelet-rich plasma or the stem cells in the case of stem cell therapy. We'll take that layer of the blood, extract it, and then put it right on to the area that's damaged. So as you can see with the ultrasound exam, we use the same ultrasound to then find the spot that's damaged, take that layer of the blood that has the healing factor, stem cells or platelets, put it right onto the damaged area, and then 6 to 8 weeks later that we can come with the ultrasound, look, see that that area's been repaired, and that's when the patient really feels the benefits of it without having to go through the recovery that surgery involves.
Right. I have so many friends who have done the reconstructive on the shoulder and everything, and it takes a really long time to come back from that, and sometimes surgeries don't work. So this is a really great alternative. Tell us about how many treatments you need.
Most people need just one treatment to get the full effects of the therapy. Sometimes if an injury is really long-standing or if there's a lot of damage in the area, it may take some follow-up treatments, but we'll explain that to the patient on the first evaluation before we do any treatment, what we think it's going to take to get them better.
Yeah. Can we talk about the affordability of these treatments? What can people expect?
So platelet-rich plasma is running $1,500.
Okay.
Stem cell therapy is $5,500, but until the end of February, we're offering 25% off either of these therapies. We also have 0% financing available for 14 months for those patients that qualify.
Oh, that's incredible.
Yeah. So we're going to give people details. This is great stuff. Thanks for coming on
Thank you,
today.
Doctor.
Sure.
Appreciate it.
Thank you.
And here are the details once again for the offer. You can call now to schedule your free consultation and receive 25% off of any of the therapy from now through the end of February. That is awesome. With 0% financing for up to 14 months, that is also available for those who qualify. So call them right now, schedule your free consultation. It is Denver Regenerative Medicine. The number is 720-583-1648. That's 720-583-1648. Write that down. Also, denverregenerativemedicine.com is their website. You can check more out there. Thanks so much. Well, coming up on Colorado's Best, give someone you love the gift of